Kia. Let's talk a little bit about how to do pelvic floor exercises. I have with me the pelvis, just to orientate you with anatomy. Here is the pubic bone at the front, which is down here, tailbone at the back, which is here, and these are the sit bones that you might be sitting on, and your pelvic floor slings between all those points and underneath. There is a superficial layer and a deeper layer. So it's really difficult to make a muscle or activate a muscle that you can't see, and so that's why a lot of people have some difficulty with activating their pelvic floor. What I'll often describe or suggest to my patients is they try imagining a few things. So you could imagine, for example, connecting your tailbone, which is your coccyx, to your pubic bone, which is a pulling this way. You could imagine that you're going to try and stop wind escaping from your bowel through here. You could also try stopping a wee mid-flow, just to get the sense of how to activate your pelvic floor. It's not actually how we suggest that you exercise your pelvic floor, but as a way to test, it is fine to do. The other two that I also like to use is, if you imagine this is a pelvis, if you imagine you had your underwear here underneath this pelvis, what you could imagine doing is that you're drawing your genitals up off your underwear. So you're squeezing and lifting up inside. The other one I also like is imagining that there's a rose sitting in the base of the pelvis. So as you squeeze and lift your pelvic floor, it's like imagining you're drawing a rose up into a tight bud inside the vagina, then drop and relax the rose and let it completely open. And it is important not just to pull up your pelvic floor, but also to release and relax and to let go. It's worth mentioning what to avoid though as well. So when you do a pelvic floor contraction, it's not about sucking in your tummy. There may be a little bit of movement low, but any pulling in of your tummy means that you're actually putting pressure on your pelvic floor. It's not about squeezing your buttocks together. It's not about squeezing your thighs together. So your thighs and your buttocks should be nice and relaxed when you do a pelvic floor contraction. There may be a little bit of movement of your tummy, but it's not sucking in, and it's definitely not pushing out your tummy. I hope that helps you to connect to your pelvic floor and to be able to activate and do pelvic floor exercises.